Assalamu alaikum dear doctors. In this video I am discussing about how can we take the fever with rash history. So fever with rash history, one of the important diseases is Kawasaki disease that is present with fever with rash. Now introduction is similar. Present history, that is we all know that the analyzing of the chim complaints. So first fever is a complaint. We ask the OCD onset, when it started, how long it's suffering, when it developed, how many minutes it continue. Diurnal variations, measurement method and medicines given. So measurement method, how you measure this? By thermometer and medication given. If you give any paracetamol, what steps you should take for that? And the paracetamol works or not, we will ask. Associations, the fever is associated with any rigors, night sweating or any abnormal movement, we ask. Did they all come together, the fever and the rash? So this is very important, the marks all together or first fever then rash develop. Okay, we ask. Then rash also we analyzing OCD onset, course and duration, when it started, how long he is suffering, the duration we ask. Describe the rash. Distribution is very important. Is it elevated, is it itchy, does it disappears when you press on it? Then other concerns, is there any other concern with the rash, any dysmorphic features, any chronic illness? Musculoskeletal system, we ask the muscle pain, skin lumps, neck swelling, size, mobile, red or hot, painful, hair, nail, lip swelling, hand swelling, peeling of the skin of the hands or feet, bone pain and joint swelling. Look, musculoskeletal system, we ask lots of things because all are going for Kawasaki disease. General FWASL, we all know that is fever, weight concern, activity, sleep, any lump or lymph nodes, plus activity, appetite, weight, activity, sleep. We in general we ask all this, how it affects this disease, his appetite, his weight, his activity, he is active or not, his sleep, he is sleeping well or not, or awake from this sleep, this problem we ask. CNS, we ask that was any vision affected, unilateral, bilateral, redness of the eye, hearing, fits, bug in the brain, decrease the consciousness level, increase the ICT signs, abnormal movement and weakness. Chest, we are asked the recurrent bug, cough, dyspnea, musical sounds and contact with the COVID and smell lost. So nowadays contact with the COVID we ask much more because we know COVID also can be any viral fever, can be rash presence. CVS, we are asking about any concern regarding heart racing, blood pressure, exercise intolerance, awareness of the heartbeat and pallor. GIT, we ask the tummy size, pain, poo, sore throat, lips fissured or peeled, taste lost. Urinary, we ask the pee, change in color, odor, burning sensations. Hematology, we ask the pallor, bleeding, bruising and bug. And endocrine, we also ask. Now, past history. As usual, the past history is 5T IOA. 5T, we know, treatment, any previous trauma, any traveling history, any blood transfusion, and which doctor's team is involved in your treatment. IOA, the previously any investigations, any onset of the disease, and any admissions we exclude. Traveling history as usual important, fever with rash because of mosquito bite. We know that mosquito causes malaria. Ticks bite very important because we know Lyme disease caused by ticks bite. Rocky Mountain spotted fever we also on the DD, so we exclude. Parental history, birth history, vaccination history as usual, no important. Allergy history is one line important. If you have to be ask in details, allergic march. So it can be allergic rash. So we ask details the allergy history. Nutrition, development, the growth charts we ask. Family history, all the person we ask that any person has this similar condition develop or not. We ask plus does any family member has current any COVID. Ask also about their vaccination status or mouth sores, herpes, eczema, herpeticum. So fever with rash present, we ask the mouth sores because to rule out the eczema, herpeticum. Social history, last days in the nursery, less than 2 weeks, lies with them or more than 2 weeks, no need. So school history, the child go the school, is there anyone on the school he has rash or not? You know, some contagious disease also present with rash, like measles. Psychosocial plus impact, how does his conditions affect the family? We also ask. Or the differential diagnosis with fever with rash. So differential diagnosis, when patient complains fever with rash, what comes on our mind? That is infectious cause, that is divide bacterial and viral. Bacterial causes of fever with rash are scarlet fever that caused by group A streptococcus, meningococcemia, group A streptococci, staphylococcal scarlet skin syndrome, impetigo, infected eczema, infected atopic dermatitis, Lyme disease and cat scratch disease. Viral causes are COVID, parvovirus, MMR, Roseola infantum, that is 6 disease, HHV6, chickenpox, varicella, herpes simplex, eczema, herpeticum and malaria. Now rheumatological causes of fever with rash are SLE, GIS, that is systemic onset and rheumatic fever. So every disease has different descriptions. This SLE come on exam, GIA come on exam, rheumatic fever come on exam. So this is a different pattern. We all know that SLE rash is different pattern, JIA arthritis is different pattern, the durations, rheumatic fever also heart concern different pattern. Vasculitis, that is Henasculin purpura. Henasculin purpura different, the rash distribution is different, and it is an acute condition. Kawasaki disease, we know that there is famous some features, conjunctivitis, peeling hands, and there is fever, rash also presents. These are PIMS. Now hematological ITP. ITP also know that different. So we know all these disease because these are common exam. Abuse should be put in the consideration in bruise. So if the patient complain bruise, remember bruise is very important. Then our mind will come abuse. Note, eczema is a term broader than atopic dermatitis. So we directly ask the eczema. So this is all about fever with rash, and the treatment we know that according to the diagnosis what, then the treatment will tell that. This is all about fever with rash. Please do subscribe and share MRCPCH with Dr. Emma Choudhury. Thank you.